Okay, ladies and gentlemen, I'm going to introduce to you Magda Papadopoulos, who will be talking on PEP Therapy and introducing their new product. And Magda said I shouldn't give you her full bio because there's a lot of stuff. The only thing that I'm going to say about Magda is that she is a key opinion leader and a physiotherapist and a proud member of the South African Physiotherapy Society. So, and the only thing that I need to say about her, what she has been guided with, her philosophy that she is guided with is, my work is my pride and my honor. Treat others as you'd like to be treated yourself. That is awesome, Magda. I'm handing over to you. Please continue.
Thank you. Thank you, Mrs. Chairman, distinguished guests. Thank you very much for your time and attending this talk, which I'm sure will be beneficial for all of you, especially considering that winter is on its way with all its respiratory morbidities, everything awaiting us. I think it's a very well-known fact that it's not a matter of if we're going to have another COVID pandemic, but when is the next COVID pandemic or other respiratory pandemic coming. And I think in the light of this, it's very important, knowing that we know what is coming, that we have an adequate response to enhance and optimize the respiratory management of our patients. Okay, so, I just want to give you an overview about PEP therapy and what PEP therapy actually is. Now, PEP is the abbreviation of positive expiratory pressure therapy. And this is a type of therapy where the patient exhales against resistance. It's a technique which, as I say, the patient exhales against the resistance. This resistance, it helps to keep the lungs open. It splints the airway. And by doing that, the patient is able to clear the mucus from the alveolar walls. And the patient can also expectorate much more easy. Is PEP therapy effective? Yes, the PEP bottle is very effective. The first time it was used was the first literature regarding that was in 1977 in Sweden, where they've proven PEP therapy to be very effective. It improves lung volume of patients. It helps alleviate hyperinflation, and it assists with airway clearance. Okay, so what is the difference between the PEP bottle that we use and the incentive spirometer? So I'm going to compare the two with you because it's quite an important concept. The PEP bottle is, as I've said, positive expiratory pressure. The incentive spirometer is insensitive. In other words, the patient breathes in. Okay, so what is the difference between the two? The PEP bottle or positive expiratory pressure therapy is used for patients mostly with obstructive airway disease. This is our patients with, as you know, asthma, emphysema, chronic bronchitis. Our incentive spirometers are more for patients with restrictive lung disease. The reason for that, the patient breathes in. Restrictive lung disease like interstitial fibrosis, so where the lungs are really stiff and the patient needs some enhancement to try and breathe in. To give you an idea, obstructive lung disease in this country have got a prevalence of about 10 to 15%, while our restrictive group of patients is about 5%. The problem is actually that when a patient with obstructive lung disease is prescribed incentive treatment, then you can actually worsen the obstructive component where you get air trapping because the patient breathes deep in now, the air actually gets trapped. because with obstructive airway disease, the problem is the patient can't get the air out. And that's why positive expiratory pressure therapy, where the patient breathes out, is so beneficiary to this group of patients. Okay. All right. The scientific literature about PEP, I think it's been proven, a meta-analysis, Cochrane reviews, that it significantly reduces pulmonary exacerbations. It improves health-related quality of life, breathlessness in our patients, and it enhances lung volumes. And most important, or very important for patients especially, it helps to aid in sputum expectoration. So it really assists the patient to cough out the sputum very much. Okay, systematic reviews has also shown PEP therapy to be very efficient in our lung treatment, our lung surgery, cardiac surgery, and also abdominal surgery patients. Oh, okay, I think I've skipped one, but let me just see. Ooh, now I'm going for the wrong direction. Okay, so that was also the scientific literature regarding that. What is the therapeutic goal for PEP therapy? Is to get the air behind the mucus, to get the mucus away from the walls of the alveoli. In other words, to mobilize it and for the patient to get to cough more effectively. Very important, especially in our emphysema group of patients where you get actually collapse of the airways. It helps to splint the airways, hold it open for a bit longer, and ultimately it helps to prevent collapse and it improves the saturation of patients. And that's actually very wonderful for patients if they're at home and they have access to a saturation probe. They actually sit, they have the probe, and they do their therapy, and they can actually see their saturation improving. And that's a wonderful thing for a patient to motivate patients to use this type of therapy. Okay, so what are the types of PEP therapy? We have usually two types. We've got a non-oscillating PEP therapy, which is the usual blow bottles that we use. And then we've got oscillating PEP devices, which cause oscillation, cause a little bit of vibration in the lungs, and which really assists very much with expectoration of secretions. Okay, so indications. As I've said, mostly our COPD group of patients. Asthma, very big group of patients that PEP is very, very important for. Any patient with atelectasis, post-operatively, I know GPs see this type of patient. The patient was in hospital, they go home, 2 or 3 days later they start coughing, and actually they have then atelectasis, very good treatment. Patients with bronchiectasis, cystic fibrosis, pneumonia, flu, where winter is coming, where there's a respiratory component of the flu. And then, of course, COVID, which we've used it a lot during COVID times, our positive expiratory therapy. Yes, another group of patients which I think is very important for us to realize that we can use PEP therapy for is for our obese group of patients. Now, obesity has been classified by the World Health Organization as a chronic disease. And because of obesity, the patients have got decreased lung volume. Due to their adipose tissue, they have a immune response where they get really hyper responsive airways. And yes, they've got high risk of lung infections and, of course, then hospitalization. In South Africa especially, WITS University has in 2023 gave a paper out where they say 23% of our population is overweight, while 27% is obese. Okay, and if you consider this, it's a very big group of patients that you can actually treat with PEP therapy. Okay, contraindications. Any patients with a pneumothorax, previous pneumothorax, undrained pneumothorax, pulmonary hypertension patients, or patients with recent eye surgery, eardrum surgery, patients with increased intracranial pressure, and patients with really severe cardiac conditions, we wouldn't use PEP therapy for. Okay, so why is it relevant for our GPs? First of all, it helps if you prescribe, if you give PEP therapy to a patient, also for the physio community, it helps to clear the secretions. It's a non-invasive therapy, so the patient can use it at home. You've got a broadened treatment options for chronic respiratory conditions. It's easy to educate the patient in using PEP. All right, and it's also an affordable treatment, which is cost-effective method of respiratory care. Okay, and I just want to say with this, what makes the difference between a good GP or a good physio and an extraordinary healthcare profession? A good GP, good physio, we will treat the disease. An excellent doctor, excellent physio will treat the patient. Okay, and I think that's very important because considering all this and the effects of PEP therapy, we must realize we have to empower our patients. You have to give them an option to take care of himself. We use it for chronic respiratory conditions. So empower your patient, give your patient the tools, and also tell them that by using their PEP bottles, using their therapy, they will save a lot on costs because the rate of exacerbations has been proven in literature will decrease and they will have a better self-confidence. It's also been proven to decrease breathlessness, which gives the patients a more better sense of having control of their disease. Okay, so this is the video about PEP therapy. Thank you. You can play it.
Easy, but for many, it's a daily challenge. Introducing RespiPEP, a simple yet effective positive expiratory pressure therapy device designed to help improve lung function and to remove stubborn phlegm. The RespiPEP brand boasts two products, RespiPEP Therapy and RespiPEP Therapy. RespiPEP uses positive expiratory pressure therapy to help clear airways, reduce mucus buildup, and enhance lung capacity. With its one-way pressure regulating valve, RespiPEP ensures a consistent, safe pressure level, preventing choking and unregulated airflow. RespiPEP is made with high-quality silicone that does not easily harbor bacteria, ensuring safety and hygiene with every use. Additionally, there are adjustable resistance levels that can be tailored to individual patient needs. The mouthpiece cover safeguards against cross-contamination and bolsters infection control efforts. The versatile no-need-to-touch mouthpiece is directing airflow for effective therapy. The Theravance unit can be connected to a T-line nebulizer. Whether managing chronic respiratory conditions like COPD or aiding recovery after surgery, RespiPEP offers a non-invasive, easy-to-use solution that can be integrated into daily routines. With RespiPEP, patients can experience improved airway clearance, better lung function, and a more comfortable breathing experience. RespiPEP, better breathing for all.
Okay, so just to give you an idea how to distinguish which device to use for which type of patient, the RespiPEP, the blow bottle, as they've used it in the past, it's maybe more for your asthmatic emphysema patient, while the Theravance or the flatter, as we call it, is for patients usually that have a lot of phlegm, because this really helps to mobilize phlegm. Our bronchiectasis, cystic fibrosis, chronic bronchitis, we've got a lot of phlegm. It really helps to mobilize the secretions and cough it up. Also for our patient that's in bed, old patients, geriatric group of patients that's not able to sit up anymore and to blow the bottle, I would recommend the flatter, which is also got a resistance dial where the patient also breathes out against the a resistance. Just to know that the flatter, the way it works, it's got a little silver ball inside. So when the patient breathes through and blows through the device, it actually causes vibrations into the chest of the patient. And this is actually almost like automatic physiotherapy. So it loosens the phlegm and the patients can cough it up much more easily. Okay, so just to know that this flatter device or the Theravance can also be connected to a T-piece. So in your hospital patients and also even your home oxygen patients or patients that receive nebulization at home, you can have the patient's bronchodilator or their saline in here. The patient take a breathe in, they get their nebulization, and then when breathing out, they get actually the therapy where they get the vibrations and then the removal of secretions and the splinting of the airways, because you use it through this dial where you can increase the resistance of the device. Okay, so that is the two devices. Cost and prescription. Medical aids do pay for it. It's got NAPI codes. I know the medical aids do pay for it. So you can prescribe it to your patients. And how to purchase it through Transform Pro distributors. And yes, I know it's available. Clicks online as well. Okay, so that is about the PEP therapy, positive expiratory pressure therapy. Then the other product that Laura has asked me to just tell you about is the perennial ice pads. And this is a instant perennial ice pad that can be used for patients that have perennial trauma or excessive bleeding, like patients after episiotomies, vaginal deliveries where they have hematomas, your hemorrhoidectomies where they have a lot of pain, piles, external piles, anal fissures, anal abscesses, that type of thing where the patient has a lot of pain.
Ice pad, your essential companion for perineal discomfort. While vaginal delivery offers many benefits, such as a quicker recovery and a strong bond with your baby, it can also come with perineal trauma and discomfort. Perineal pain can significantly affect your physical, emotional, and social well-being during the postpartum period. Horse riding, cycling, or hemorrhoids and hemorrhoid surgery can cause significant perineal pain. Studies show that localized cooling can help reduce pain intensity, contract bleeding, and lessen swelling, offering relief from perineal discomfort or injuries. The Allura Instant Perineal Ice Pad is designed to soothe swelling, ease discomfort, and support healing, whether you're recovering from childbirth or managing hemorrhoids. The pad is fully absorbent yet breathable and cools down to a comfortable range between 8 and 14 degrees for targeted relief where you need it most, helping you to recover comfortably. Easy to use with proven efficacy, it's the support you need to focus on what matters most, your recovery and your time with your baby. Give yourself the care you deserve with the Allura Instant Perineal Ice Pads, because healing starts with comfort.
Okay, so conventional ice therapy, just the difference between conventional ice therapy and the perineal pad. Usually ice packs or ice cubes were used, not always available. And if you use it in dry cloth or a towel, for example, on the perineal, you can actually damage the skin if you remove it, because the skin is very fine and tender. Cold packs, gel packs, it is, you need a deep freezer for that. So, and of course, it's not always available, deep freezing. And it's also, when it comes out of a deep freezer, it's very hard and not easily pliable. So it's difficult to use on certain areas. Vapor coolant spray can cause actually skin irritation, and it's also not as deeply, it's quite a superficial type of cooling of areas. And then, of course, immersion in cold water or ice baths, which is not very comfortable always. So, yes, so in other words, this is a very nice product. It's got an absorbent type of layer where if the patient have a discharge, it will help to absorb. Yes, it's gentle on the skin. It can follow the contours of the body. It's anti-inflammatory, which causes minimized bleeding, pain control. You can use it localized, targeted areas. And yes, it's hygienic and convenient. Quickly you have a cold pack available. The way it uses, it's got a gel inside. So you just break the gel, the package, the gel spreads, and you've got a nice flat ice pack or cooling pack that you can use on the area. Okay, indications, postpartum, C-sections. You can even use it in a C-section over the pelvic area, not always necessarily perineally. Perineal tears, pelvic floor dysfunction patients, chronic pelvic pain, cysts, abscesses on the perineum, painful bleeding hemorrhoids, post-hemorrhoidectomies, anal fissures, patients who had prostatectomies where there's swelling and pain and discomfort. So there's quite a lot of indications for this. How to use, as I've discussed, very easy. You just snap it and you place it on the area. Okay, and once again, the cost prescription, it is got a NAPI code, so once again, the medical aids does pay for it, and you can order it from Transform Pro Distributors, or just write a prescription. Any pharmacy should be able to give it to the question. Okay, so thank you very much for lending me your ears. I appreciate that.
Magda, any questions from anybody? Everybody happy? So if you want any questions or have any questions, I don't know where my words have gone, please visit the Leo Steph stand right behind you. They will be able to take you through all of this again. And yes, thank you for listening. Magda, thank you so much for being here.